Hi everyone. I know there's been a lot of stress about the organization of your thoughts and how to study for a clinical portion of the Revalida. So I wanted to start with this video rather than doing some of the other history taking videos that I told you about. It's more about the logical thought process and how to approach a theoretical case when you're in the process of receiving that history and eliciting that history with your standard patient or with, your role-playing patient. So of course, you guys know this already because you're doctors. We start off with the general data of our patient. So we have, as I've written here, the name, age, and gender, date of birth, marital status, place of birth, the current address if it's different, and the occupation of the patient. And finally, at the end of the theoretical case, you should be given the chief complaint and at least the current vital signs of the patient upon presentation to the clinic or to the hospital emergency room. So the first thing you want to do when you read the case before anything else is you want to think three things. The first is there any pain? Is my patient in pain? Is this process acute? The second thing you want to think is, has there been any trauma? And then the third thing is, has my patient lost consciousness? So after you decide or have figured out those three things, they will help guide the rest of your history taking as well as your physical examination. So for example, we could do a sample case. We'll say the patient's name is Wan Ting. He is 20 years old, a male. His birthday is June 20th, 2000. Okay. He is single, was born in Manila. Current address is still Manila. And he is a student of biology. Okay. Then his chief complaint says he feels his heart racing. So feels heart racing. Again, this is verbatim what the patient says. We're just abbreviating right now for the purposes of this presentation. And then finally, vital signs. So my trick is that I always write the vital signs in the same exact way so I never forget anything. So I start with pulse, blood pressure, respiratory rate, and temperature. So let's say he is 86, 120 over 70, respiratory is 18, and temperature is 37. Okay? So you would be given a case, for all intents and purposes, this is exactly what you would want to be looking for. The case may be long, the theoretical case may be a paragraph, it may give you other information that can lend to your history taking, but you want to start off making sure that you have this appropriate information. So especially looking at some of the most important things to consider would be his name, because you want to make sure that you're calling him the right thing, age and gender, of course. You want to look at marital status, because this can help rule in and rule out, especially in the cases of infection, if he's single, if he has multiple partners, if he's married, etc. You would want to look at his address to see if anything is endemic, if there are endemic problems to a situation, and occupation, of course. And finally, other than the chief complaint, you want to encircle any abnormal vital signs. So when I receive a case and I'm looking at it, the automatic things that I'm thinking, other than the three questions I told you earlier, are looking at my chief complaint. So looking at my chief complaint, what are the major body systems that could cause these symptoms that the patient is experiencing? So for heart racing, that would be, in medical terminology, palpitations, right? So this patient is complaining of palpitations. So automatically, at least three systems that I can think of: cardiac, I also think thyroid, right? And then also maybe just psych, neuro. Because he is a student of biology, let's say it's finals time. He has exams coming up. So that's something that we can think about. So once I already do this in the beginning, before I even start to elicit my history, I kind of know where I want to lead myself. Okay, so let's set this case aside, and then I will show you how I configure my scratch paper. So the first thing I do before anything else is I fold this in half. Okay. And then we can ask, or we start with the history taking. Before anything else happens, I take note of my most important things from my theoretical case, which would be a 20-year-old male who is single, student, Manila, presents with palpitations. Okay, so automatically, and then I write the vital signs down as well. So again, pulse 86, blood pressure 120/70, RR 18, temperature is 37 degrees Celsius. Okay, and for me personally, for example, if there were any vital signs that were abnormal, I would encircle them so that I could see. It would be a visual cue to myself that this is something that you have to investigate. This is something that you have to look for. This is something that you have to ask about in the HPI. So far our patient is asymptomatic at presentation to the clinic. Okay, so this is when you would start your HPI. Now, the important thing about the HPI is to ask everything in the same order. So first you ask an open-ended question. Please tell me more about your palpitations. Can you tell me about why you came here today? Can you tell me more about what you experienced? So you let the patient talk. While the patient is talking, you do your best to write things down in the most chronological way possible. Okay, so try to keep things chronologic, so you have like a timeline. Try to keep in mind the abnormal vitals if there's any. And then also make sure that you investigate the chief complaint thoroughly. And what I mean by that is you want to make sure you ask when, how often, does it affect his lifestyle? And go from there, okay? Finally, you're going to move into ROS. Okay, this is where this little thing that we did, narrowing down our 3 major organ systems, that's what's going to help us here. If he didn't mention it here, it at least gives us 2 organ systems to think about. So let's just say he says that, he was running around once in a while when he sits down at rest. It happens randomly. He feels his heart racing a little bit. Then we can rule out, or we can think, okay, if it's only once in a while, it only happens on rest, doesn't happen with exertion, maybe it's just an anomalous, palpitations, or like a quick, arrhythmia. That's normal in a 20-year-old male. Okay, so cardiac. But, for example, if the patient is speaking to that and you don't see any signs and symptoms of the other 2, this is when you would ask. So if we're assuming that the patient is a cardiac case based on HPI, in ROS, the first thing I would do is ask thyroid questions. So if you're having a thyroid condition with palpitations, you want to ask, do you have intolerance to the heat? Do you find yourself losing weight, etc.? And then with psych and neuro, because of anxiety or stress, you can ask about his current situation. Is he feeling any stress? Have there been any major changes to his routine? Have there been any major life events? Those are things you want to ask. The main thing too that I always like to ask in ROS, barring other than other issues, is I like to make sure I get these 5 important points. So sleep changes, diet changes, weight changes, and then bowel, bladder. I always tuck those in right at the end, just to make sure I cover almost everything. All right. After ROS, this is when you would go into their sexual, social, right? But before this, actually scratch that, guys, sorry. This is when you would do family history, past medical history, right? Family history, and then social, sexual history. Once again, you want to make sure you ask all of these questions in the same order every time you practice so that you get into the rhythm of asking them in the same order. It helps because once you get a flow going, you keep going, you know? It helps you with the logical thought pattern organization in your own mind, as well as organizing the case on paper. So while you're taking these notes, you're basically writing your recitation for clinical, okay? So after that, we're then going to move to PE, okay? So I don't know how you guys are doing a PE for your oral Revalida, but I would assume that you would pretend to do a PE, or you would explain at least the test that you would want to do and findings that you'd want to look for. So with PE, again, this is when you would focus on the 3 to 4 main systems, because when you do this, you're basically focusing on your 3 to 4 differential diagnosis. So for palpitations, we decided that it could be a cardiac origin, thyroid origin, and what did we say the last one was, because he's a student? Great. Psych and neuro. See, you guys totally got this. You're going to be great. So we would start from, so for me, this is what I would do. Start from most likely to least likely. Why? Because you'll likely spend most of your time talking about the diagnosis that you believe to be the true diagnosis. Okay, so this most likely discussion here, it is going to set you up for introducing and defending your final diagnosis. Okay, so sorry about that. So then after that, you discuss each of these things, each of the PEs that you would do. So you don't want to forget ever in any situation, make sure the 2 systems you always look for first are cardiac. So you would do heart sounds. You would just do like regular EAP for cardiac, okay? Then do pulmo. Make sure he's not in respiratory distress. So again, you would do IPA. Okay, so this is automatic. Number 1, number 2, cardiac, pulmo. Then you would go into your associateds, okay? So you could do a thyroid / ENT, because it's there anyway. And then also for your psych, neuro may not be necessary, but this is where you could show off and kind of talk about your like HAM-D or like youth depression scales, things like that. Make sure that the patient is okay. And if you don't want to do neuro or psych in this case, you could probably just go on to make sure that you pick a system that's just relevant to palpitations. But for me, I would kind of just do a mini mental status or a mini scale exam, especially if the patient says that there was mental trauma or a life-changing event, or if there was actually head trauma. For example, he was an athlete, hit his head, and he only started to experience it then, etc. So those are things that you want to consider. But always, always, always at least do cardiac, pulmo, and then the 3rd and 4th vestibular exam, those should be based off of your differential diagnoses that you've fixed in your head, okay? So then after that, you kind of have like what I like to call a synthesis. So this is when you tie together your HPI and PE. Okay? That's when you tie it all together. This is when you define your diagnosis and answer why. State your differentials and why they are not likely, why they were considered, first of all, why you ruled them out. Okay? And then from there, you go into your treatment and management. But for the most part, in oral Revalida, I will have to say that the majority of the focus is on your history and physical exam. They will ask you, why did you do those things? They will ask you, what did you expect to find when you did that? If it's normal, if it's abnormal, did you expect to hear a murmur? What does that murmur sound like? Things like that. You want to make sure that your history and physical exam are solid. And then you can speak to and look up the treatment and management and prognosis. That's something you guys always want to consider. So toward the end, especially, so I'm just going to flip this over. So you want to make sure that after you do diagnostics, so these are any labs that you would order. So for example, in a case with palpitations in a 20-year-old male, what's the first thing? You want ECG, right? You want to check laboratory. So you do CBC, urinalysis, diff count. You'd also just want to do thyroid function. So FT3, FT4, TSH, okay? And then they will ask you, why the ECG? You want to rule out cardiac abnormalities. Why CBC, UA, and diff count? You want to make sure that the patient is not suffering from hypoxemia or doesn't have any other concomitant infections that could cause this symptom. And then why FT3 and FT4? You want to rule out thyroid conditions or hyperthyroidism, to be specific. So after you do diagnostics, you go into treatment and then management. So long term, what will you tell the patient? What will you teach them? Prognosis, will my patient die? Can he live with this? Will he have permanent changes to his lifestyle, etc.? And then finally, usually they will ask sometimes for extra points, preventative medicine. So basically, anticipatory guidelines. And also, you can say vaccines. You can counsel on, like for example, a 20-year-old male, you'd want to do safe sex, or in our case, abstinence, right? And then also, what else? You can do lifestyle, like sleeping better, good nutrition, because he's probably in college, and eating my favorite JQK chicken. Okay, so this is when you would conclude. So for me, a good conclusion restates your diagnosis, why you chose it, and ties your case together. Okay? So there you have it, guys. I hope that kind of helped. And if you have any questions, I'm online all the time. So please feel free to message me individually or via the group. Okay? So thank you, doctors. Good luck and keep fighting. Bye.